Okay, so I'm going to spend a little time on fraud. If you don't feel like the explanation of benefits looks compliant, it's not. I had a client yesterday that I consulted with. She had to give a surgeon, no names for HIPAA reasons, but I can say it's a girl. She had to give a surgeon $1,600 up front to have a surgery when she has a procedure. The particular individual has a $2,500 hospital deductible. We are being told by said hospital, good hospital in the area actually, but anyway, no names, that she owes the full money. And we're saying, wait a minute, we've already given the physician $1,600. Make sure you keep paper trails, like the person in the appointment that was with us. Check your checks. Make people held accountable. In today's paper, Medicare fraud brings prison time. A Brookfield podiatrist has been sentenced to more than 3 years in prison for defrauding Medicare. It's actually quite easy to do a wrong CPT code. And physicians have extremely high malpractice lawsuit insurance. We call it errors and omissions. They call it malpractice. So the downfall is sometimes they get a little careless. And they think, other than clipped and trimmed a patient's toenails, that they may have, some kind of here a little, there a little, did some injections, some performed nail ablations. No, they didn't. They didn't do any surgical procedures because the fraud unit called the clients and said, well, did you have these things done? They're like, no, I just got my nails clipped and trimmed. So clipped and trimmed. But the most important thing is be held accountable. If you are losing it a little and you're in your upper 70s or 80s and your memory's not as sharp, and I can tell you right now, I don't know what age Barbara David is, but she is sharp as a tack at barely age 60. So, if you know yourself and you're not that great with paperwork or you're not that savvy, ask a daughter, ask a son, ask your husband, ask a neighbor, ask someone to look it over. You get it every quarter or month, depending on your medical needs. It's called an explanation of benefits. EOB, we always say. Right then and there, it'll tell you the procedures that you've had done. Now, another thing that's funny, podiatric medicine or podiatry work is only done on an Advantage plan. A Medicare Advantage plan is supposed to be equal to or better than what Medicare offers. But Medicare doesn't cover regular podiatric visits or vision or chiropractic. It will cover medical necessity stuff, but clipping and trimming, that's wellness, that's maintenance. So it's usually with the diabetics that I'm bringing this up. Again, if you're a diabetic, make sure you know they are free. I would love for a caller to call in now and say, wait a minute, I've been paying for these things. You're not supposed to if you're Medicare eligible, or if you have been getting it for free, let us know your pharmacy and we'll give that pharmacy a plug because they're honest. This particular big box shop wasn't honest to my client, and she's been paying for quite a long time. If you feel you've been wronged, you always have the Office of the Healthcare Advocate. The ombudsman is a personal friend of mine. She is Victoria Veltri. And her right-hand person, Maureen Smith, and I speak regularly. I actually talked to her yesterday afternoon. So when you smell fraud or you see fraud, call people on it. The doctors in our area, thank God, are excellent. They really care. Because Waterbury is a city. It's not a little affluent community where people really might not look at the explanations of benefits. Brookfield happens to be a little more affluent. So maybe someone just assumed, well, I don't know, of course the physician was right. Please look at your explanation of benefits. CPT coding, computer processing technology. I just use that acronym because CPT, I do not know exactly what CPT stands for, but there is a proper word, which I'll have for next show. My buddy Lisa probably would know it all day. But ICD-9 and ICD-10 are coming. 10's the new one. It's very specific now what the codes are for. So if you're out there and you're getting a lot of co-payments or a lot of bills, remember, if you have a Medicare supplement, it's zero co-payment to the doctor and zero co-payment to the hospital. That's why your premium is so much higher monthly than a Medicare Advantage plan. A Medicare Advantage plan through Aetna, Anthem, United Healthcare, Connecticut, WellCare, they are having you give up original Medicare and take an Advantage plan, which means you've agreed to use the terms and conditions of the contract. You've agreed to use those doctors and those hospitals, usually with a copay or a percentage. The new percentage for 2014 across the board is going to be, and you know us by heart, they just went with it as well, 20% copayment on outpatient surgery. Everyone had fixed rates at sometimes $200, $150, and those were great. But now, with the Medicare stipend that they give per month, most carriers, actually all carriers, but I can't say anything until it's in print, and you will get that in print, which is called the Annual Notice of Change. My producer, Trish, and I did a commercial before the show. ANOC, Annual Notice of Change. Everyone is going to get that around the last week of September. Make sure you look thoroughly through it. It will explain the changes to what your plan is. All right, so if anyone has any questions on that. Again, what I'm trying to do is look out for your best interest here. Look at those explanation of benefits. Know what product you have. The first caller seemed pretty sharp. He's like, no, I left original Medicare and I went to, and I said, the Advantage plan. He's like, yes. Well, that's at least 55 to 75% there. He really did know what he had. Also, another thing, a great client 3 years ago came into my office, and I said, no, keep what you have. You have great coverage. Your wife has really good coverage through work. Keep it. Well, they came into the office this week, and it was nice. He's like, I remembered you. I listened to you on the radio. Make sure you turn on, and I said this 2 weeks ago, your Part B, as in boy or babe for you ladies out there. Medicare Part B. A is free when you turn 65 or you become disabled. And B is something you must elect to take. When you elect it, it will cost you, depending on your income, which is called IRMAA, I-R-M-A-A. Depending on your income, it will most likely cost you $104.90. If you're paying more, that means you're affluent and you're making way more than $170,000 married or $85,000 single. So you must turn it on. After 63 days, you have no luck. You must turn it on before the 63-day window of time. This also follows the HIPAA laws. So if any of you out there get laid off, like the particular individual that called in earlier, she will have 63 days to secure other coverage without a pre-existing condition clause. Well, some people say, well, I'm getting a severance package. And I asked the HR director, is it a severance package where she's going to be on the books, or is it COBRA? She said COBRA, Consolidated Omnibus Budget Reconciliation Act. May 5th, 2010, us nerd lobbyist insurance agents under CBB, now they call it AHU, or NAHU, National Association of Health Underwriters. We lobbied to have COBRA extended from 18 months to 30 months, so that did pass. But when you're on COBRA, you are not actively at work. So therefore, you still must sign up for Part B so you do not receive a penalty. All right? I cover that in length. All right. Any callers? Please call in. We're going to have my producer Nick. One of the reasons the YouTube page is so beautiful is for compliance. To our veterans out there, God bless you. Thank you so much for fighting in Iraq and Iran, Afghanistan, Tehran. I'm not 100% sold on this Syria thing. That's really more for Larry Rifkin. I'm not going to comment at all on it. It is up to our president to make that decision, and President Obama will have to make that as our leader. But the veterans are really the ones who are suffering. Please, if you can, offer them a job. If there's anything I can do with getting them benefits, I will. Why am I remembering them? Because after the buildings came down 12 years ago, and also hug a firefighter today or a EMT or a first responder. I saw some studs at work today with the car exploded right in front of the Macy's under the underpass, and I actually have it recorded. And you should see these guys. They pounced out of the truck, screaming full stream, spraying the truck as it's engulfed in flames. And I'm like, yeah, These are Americans. All right, ladies and gentlemen, here is producer Nick. He's going to explain how to go to our YouTube page, please.
If you would like to watch previous broadcasts of Medicare and You, you can do that. You can go to www.watr.com, and that's WATR's official webpage, and on the bottom of the page is a big red button that says YouTube, and you click on it, and it takes you to WATR's YouTube page, where previous broadcasts of Medicare and You are listed in chunks in order that they aired. And you can rewatch or watch for the first time any broadcasts that you may have missed. Or if you'd like to just go straight to YouTube, you can go to www.youtube.com and then search in the search prompt for Medicare and You, Michael Regan, and previous broadcasts will pop up. Their date that they aired is listed, so you know exactly when the show was from. Also, if you'd like to email Mike a question, you can email him at watrmedicareandyou@gmail.com.
Beautifully done. All right, as usual, the phones are getting lit up. I love it, love it, love it. Michael Regan, how can I help you?
Yes, Michael, I'm from Prospect, and I'm going to let you know that CPT stands for Current Procedural Terminology.
God, are you good? Current Procedural
Terminology. And you can find some of these codes out on the computer, too, because I'm looking at it right now.
All right. You looking for a job? Oh, I love it.
No, I'm happily retired, so.
Okay, so CPT code, current procedural terminology. As you know, because you obviously know that, did you Google it or did you just know that because it was your industry?
I kind of knew what it stood for, but I had to double-check myself, so I just punched it in just to make sure I got the...
Nice! You know what? I actually have a smartphone right next to me. I could have done it. But I don't like to try to wing things if I don't know what I'm talking about. I will repeat this about 18 times a day until I have it down pat. Nicely done. All right, so to my listeners out there, shouldn't they really check those EOBs to make sure things are coded in accordance to what you feel you had versus just letting the coding go blindly and all of a sudden you find yourself owing more money than you thought?
Most definitely, they should check it.
Right. Oh, it is so great to know that people are actually listening out there. This is what I always try to tell people. Someone will always say, well, wow, I didn't know I owed that much. Maybe you didn't owe that much. A good friend of mine who owns a paper company, his physician didn't CPT code for a V code for wellness, for a colonoscopy, and he was told going to the particular facility that he owed a copay. Copay was $500. I got on the phone. I happened to know them, and I called up and I said, no, I know this individual. He's perfectly fine. He didn't have a polyp. It was CPT coded, current procedural terminology coded with a V code for victory for us, and we won the battle. God, I love you. Thank you so much for calling in.
And they use ICD-10 codes.
Yes, well, that's new, don't forget. ICD-9 is out now. ICD-10 is being rolled out new.
Right, and they also use them for codings, too, so sometimes you got to make sure when you go for procedures that they have that down, too. And
do you have any particular website? If you don't have it, I can get it from my buddy Lisa. But are there any particular websites clients should be looking at to get the proper coding for the procedure they had?
I'm trying to look at it right now.
All right.
If I can find it. It's kind of difficult. Oh, yeah, you should just Google it, and then they can find it, too.
She will text me, and next show, I will definitely air it out there. This was a great call. Thank you so much for listening. Prospect, what a great town. My dad lives up in Prospect.
Wonder? That's great.
Have a great day.
You too.
Bye-bye.
Bye-bye.
All right, so